My name's Ken King. I'm the Vice President of Facilities and Support Services here at El Camino Hospital.
So tell me about this massive project you've been up to over the past
7 years.
7 years.
7 years. And about November of 2002, we began embarking on this project. And for the past 3 years, we've been under construction of our 460,000 square foot facility, expanded central utility plant, and various site improvements to go along with that.
Fantastic. So over the course of these past 7 years, what do you see as the 3 biggest challenges that you came across?
Well, certainly it's been maintaining the momentum and the schedule of activities, starting with the design phase and the hundreds of design sessions that occurred with a number of people throughout the facility, with doctors and nurses and staff, as well as the schedule of production of the construction documents with the design team, the architects and the engineers and the contractors, and then the building permit process, 2 years in plan review, 5 different reviews of the plans and specifications before a permit was received, and then 3 years of construction. Probably our biggest challenges were in the area of expanding our central utility plant. The big hospital construction actually was, although it was on this campus, the hospital campus, it was for the most part a greenfield location on the campus where we cleared the path and that construction went smoothly. But the central utility plant was an expansion of the existing service plant utility area, and we had to maintain operations to the existing hospital while we expanded and replaced all of the equipment to serve the new hospital, and all the while ensuring that we didn't disrupt services to the existing hospital operations. And we were quite successful, but it was an extreme challenge to ensure that success.
What did you have to do to overcome that challenge?
We had to have the right people doing the right job and doing it right. It required a team of people from both the contractor side, our operating engineers in the central plant, and our commissioning agents and project managers coordinating activities and reviewing schedules and plans. And really, it's about coordination of activities and meeting the needs of code requirements and the complexities of system requirements. It really just took a team effort.
Tell me more. What's another
So other challenges in the course of this, so maintaining the momentum and schedule being a big one, but the other challenge was the communicating complicated information to our board and to the public and to our staff to keep people informed of what was happening. The challenges of explaining the rising costs when we went through our design phase, our permit phase, and had upwards of 66% increase in construction costs for California hospitals from 2003 to 2006. That created some communication challenges, and getting that message across in a clear and understandable way at times was challenging, particularly in the public forum in which we operate, and that created some challenges for communications.
So because you're a not-for-profit hospital and not a private entity, it's sort of this extra step you have to take to make sure the community knows what's happening.
Well, we're a community-based hospital, and we're accountable to this community, and it was important to us and to our board to be able to communicate what we were doing, how we were doing it, and what the impacts were. And so the complexity of the message, the complexity of the information to bring people to understanding made some of the communications a challenge. We also had challenges in keeping people informed of what we were doing just on a staff level. A project that takes 7 years to complete, and 2 years in design, 2 years in plan review and permitting, 3 years in construction. Things change, people change. Some of the people who come into the organization in the last 2 or 3 years weren't here when we did the design. They were not privy to the design criteria or the understanding that we had when we did the design. And because the process of constructing a building starts at the very beginning in design and in your plans and specifications and your permit document, all of those are building blocks. When you get to construction, it's a little late to make changes in your design if you want to avoid costly overruns and schedule delays. So keeping the communications open during, with all of that dynamic was a challenge over the course of the project. The teamwork that we established early on. So we have a somewhat traditional model of contracting with our architect, directly with the architect to create plans and specifications, and we have a construction manager who is also our general contractor. Those entities, we have a traditional contractual model, but we have a teamwork approach to getting our work done. And having an understanding of how their businesses work, along with how our business works, allowed us to create, to remove barriers actually in our communications and in the style in which we approach the project, to really approach it as a team. And we were successful in putting incentives for our design team and for our contractors that align them and allowed for us to focus on the task at hand and not be overly concerned that things weren't going to be made right at the end of the day.
So did you see that as one of the keys to success?
It absolutely was a key to the success. Mm-hmm. Examples of that would be simply our commitment to have a quick turnaround time on payment applications. On a project of over $300 million, the monthly payouts are in the $8 to $10 to $12 million a month. There's a lot of, it takes a lot to get a payment application like that completely in order. And we invested in hiring the right accounting staff, the right experienced staff, so that we could do a quick turnaround, a review of those payment applications and be able to pay and what the contractors, I believe, would tell you is record time on a monthly basis. That cash flow allowed our contractors to keep the momentum going in the field and keep the construction moving at a fast pace without having to finance their activities through other projects or other means. We structured our payment schedule so that the work of the contractors and the subcontractors was the cash flow provided by the project payment schedule allowed them to stay on track and not be concerned about getting paid. That was just one factor that contributed to the success of the maintaining the schedule and the momentum. It's surprising how fast 3 years can go by, mm-hmm. And it's really surprising how much you can accomplish when you put your mind to it. Mm. And I think that when you put a bunch of minds to the same task, when you put a team of people and focus them on a goal of accomplishment that seems on the surface not realistic, to complete a California hospital construction project on time and within budget is virtually almost unheard of. It almost never happens. There are some that have claimed to have done it. There probably have some that actually have done it. But in this day and age with rising costs and escalating factors, an economy that's shifted from one point to another during the course of construction, and the fact that we've been able to maintain that schedule and the momentum and get to the completion of our project within our budget is a big task. But having everyone focus on that collectively, I guess I expected it, but to a lot of folks that's a bit of a surprise.
And what was the goal, the goal budget and the goal deadline?
So our goal was to basically be completed substantially completed with our construction by July of 2009. Our budget of $480 million is to be within that budget of $480 million, and that included early phases of construction, central plant expansion, the new hospital construction, and all the related soft costs, and all of the fixed equipment that goes into the building. Those goals were accomplished, and our target date of moving in mid-November is on track, and we're excited.